It's really a pleasure for me to be able to speak to you about the THEMIS trial. This was a 19,000 patient trial of patients with diabetes and stable coronary artery disease, actually the largest trial to date of patients with diabetes ever done. And what we studied was Ticagrelor versus placebo in these patients on top of low-dose aspirin therapy. Patients were followed for a little over 3.5 years, and what we found was a significant reduction in the primary endpoint of cardiovascular death, MI, or stroke, favoring Ticagrelor plus aspirin versus aspirin plus placebo. There were lower rates of myocardial infarction, including ST segment elevation myocardial infarction, lower rates of ischemic stroke, as well in some exploratory endpoints, there were lower rates of amputation and acute limb ischemia. So overall, reductions in important ischemic events. There were no significant differences in cardiovascular death or all-cause mortality. There was a significant increase in TIMI major bleeding, which was essentially doubled. There was also a small but statistically significant increase in intracranial bleeding. This consisted largely of traumatic subdural hematomas, which occurred at a higher rate in those patients randomized to Ticagrelor versus placebo on top of aspirin. So how do we synthesize all these data? Well, we have identified a subgroup that looked particularly good in terms of patients who benefited. THEMIS PCI is what that study is called, and my co-chair of THEMIS and colleague, Professor Gabriel Steg, will summarize that in a segment on THEMIS PCI. But where THEMIS fits in overall in the context now of dual antiplatelet therapy is it shows us benefit in a lower risk population than had previously been studied in trials such as Pegasus or Plato, which had separately found benefit for Ticagrelor in patients with acute coronary syndromes and in those with a prior myocardial infarction. Now, in a lower risk population than those populations, but still a high risk group of patients, those with diabetes and coronary artery disease, we find that the addition of Ticagrelor to the standard of care, including aspirin, has the potential in carefully selected patients at low bleeding risk to improve their rates of future cardiovascular events.